Welcome to Cartagena, Colombia, and the project Basin Sea Interactions with Communities, known in short as BASIC-Cartagena. In the islands off the coast of Cartagena, there are numerous communities of Afro descendants with a total population of over 20,000 individuals. Traditionally, these communities have depended on artisanal fishing, while in recent years, much of their economy has shifted to tourism. However, conditions in these communities have led to impacts on human health. Most of these populations do not have a continuous supply of fresh water, as the city's aqueduct does not extend to the islands and rainwater is scarce. Water is therefore transported by boat and stored and distributed in the communities. Furthermore, the communities lack proper sewage systems, which further increases their risk to water-related illnesses. Access to health services is also limited, as health centers in most communities only provide basic care, while some communities have no health center at all. This lack of water supply, sewage systems, and health services make the coastal communities vulnerable to health impacts caused by water contamination and other related illnesses. To help reduce the vulnerability of these communities, the BASIC project has carried out research on health and education since the project's inception in 2014. Funded by IDRC and CARDIQUE, BASIC is implemented by the Universities of EAFIT, Los Andes and Cartagena, in collaboration with the Foundation HEO. The project's health and education activities have been led by the University of Cartagena through its doctoral program in tropical medicine and its research group, UNEMOL. This research team, composed of medical students and professors, has carried out various health and education activities with hundreds of community members, including general health diagnostics, water quality analyses, assessments of heavy metal accumulation, and capacity building to generate consciousness in the care and use of household water resources. To analyze water used for human consumption, the team took samples from household taps and storage tanks. Samples were then analyzed in the laboratory, showing that some of the waters were contaminated with microorganisms, such as coliforms and bacteria. General health evaluations in the communities found various skin and stomach ailments, which could be related to the quality or scarcity of household water supply. Blood tests revealed that some inhabitants have high concentrations of mercury, as well as other metals such as cadmium and lead. Metal pollution has already been found in the fish and sediments of Cartagena Bay, and so these new findings now show the health impact on the human population, which is particularly concerning for local fishing communities. The BASIC project has also made a dedicated effort in education and capacity building in Cartagena's vulnerable coastal communities. By teaching community members about the significance of the project's research findings, the aim is to help them become leaders in their communities in the use of strategies for water management and health safety. Capacity building was first focused on school teachers so that they could include this material in their curricula on natural science and water. Instructional sessions were then carried out with students with the view of creating a group of water guardians that can then share this knowledge with their homes and neighborhoods. Finally, female household leaders were educated on practices for water management to prevent related health impacts. Starting in 2018, this effort was taken a step further with the initiative Women and Water, which combined lessons on water safety with workshops on leadership. The aim is to empower these women to become leaders that can educate others in their communities and homes about the importance of water and its care.
Queremos mejorar su calidad integral de vida, atacando especialmente la educación en salud para convertirlos en líderes de la salud. Y especialmente lanzamos el programa de Mujeres al Agua para que la mujer sea cabeza y lidere a sus hijos en educación y además en que se eduque al turista que llegue, que respete las islas y que se pueda hacer una salud integral.
Throughout the BASIC project, the team at the University of Cartagena has monitored several viral illnesses in the communities, such as dengue, Zika, and chikungunya. But in 2020, the team was faced with an entirely new challenge with the global pandemic of the coronavirus, COVID-19. Since then, the UNAMOL laboratory has been combating the pandemic by providing COVID analyses for the entire city of Cartagena and the province of Bolivar. Accredited by the National Health Institute, the UNAMOL laboratory helped Cartagena become the first city in Colombia to analyze COVID, and the BASIC project has supported the effort with resources dedicated to testing in the coastal communities. The coronavirus pandemic is just one of many challenges that highlight the health risks and the risks of inadequate water supply in Cartagena's coastal communities. Through research and education, the BASIC project aims to reduce the vulnerability of these populations by spreading consciousness on the connections between water practices and human health, and to contribute to the overall resilience of the people of Cartagena Bay.